I'm here. I'm on my lunch break. I haven't had a haircut in about a few weeks because, with all this corona stuff, I can't go to my barber right now. He's gonna come to us on Saturday. I work at a hospital that rhymes with, I'm not gonna tell you the name of the place that I work at. It's in Southern California. It's connected to a university. There's not too many coronavirus cases at my specific hospital and the organization, all the clinics, stuff like that. I think they've only had around 8 cases, and this is in, like I said, it's in Southern California, the Inland Empire. But in my opinion, I think majority of people have the coronavirus to a certain degree. Everybody's coughing when they weren't coughing, and it's like a consistent cough that everybody has. All these patients that are coming in have. I work in urology, so it's a specialty clinic, so we don't see as many patients as maybe like the urgent care or like a family practice would see, or even like the emergency room. We don't see as many patients as they would see. So on a typical day, one of my doctors would see about 25 patients for the whole day in clinic visits. So what they started doing now is they started using an app called doxy.me, and that way that allows the doctors to have a video visit with the patient. So you're still able to see, the doctors are still able to see the patients. If the patient needs to show them something on their body, they can still do that, which is really convenient. It's easy for us to assist the doctors in doing that. So this morning, it was one of the doctors that I work at. It was his first day using it. He saw 12 patients via the doxy.me, where they're video. One patient didn't want the video, so they did a phone visit. And so he had no live patients come in. And so this afternoon, he has, I think, like 8 to 12 patients. Majority of them are on the video conference call, but I think he has 4 patients that are going to come into the clinic. One patient is a cysto procedure that we're going to be doing. So we're definitely going to have to, So what we do is, there's a number of us in the clinic. We're all wearing these when it's just us in the clinic. If these are just the basic masks. But when we have a patient that's going to come in the clinic, we have to put the patient in the room and do some kind of procedure on the patient, we wear the respirator mask, which I'll show you in a minute. I have mine in the inside. I'm just trying to milk my lunch as long as I can so I don't have to be in the building. I feel like it's everywhere, It's all over in the air, I think. So I'm kind of gonna do like a vlog of just my situation in like the medical field. I was not able to get tested for the coronavirus because I don't have enough symptoms. I've never had a fever. I have a cough. It's because it's for people that have a lot of symptoms that really need it. So I guess it's kind of okay. I just been taking different things to try to boost my immune system, which I'll talk about later. So I'm gonna start vlogging my kind of daily activity here in the medical field here at the hospital. And then also I work in, it's called a congregate home. I do like 1 or 2 days on the weekend. It's like a small house that has ventilator patients. Just to kind of show you guys what we're kind of dealing with out here on the healthcare front. So I'm gonna head inside, and maybe later on I'll show you guys my ventilator that I have. We're using these when there's no patients in, and then when the patients come in, we'll use the ventilator. I didn't know if you can hear me, but it's very hard to breathe in these masks here. I'm waiting for my first live patient to come in. So I stepped out for a minute. They have all the exits locked, the front of the building. They're doing like a triage where they're like triaging patients and staff, asking them questions like, do you have fever, cough, or anything like that? I don't know what they're doing to the people if they say yes, but on our badge, we get this thing that says cleared, and I just put it on there every single day. You see how many, you get a different colored one for each day, so. And the patients, they just put it on their jackets and it says that they cleared to come into the building. So they're doing some type of screening to kind of not let, the patients that have, but you can just easily lie though, just to get in for your appointment, just to see your doctor. You can easily say, oh no, I don't. Because a lot of these patients, they come in and they're coughing and hacking and all that stuff, so, all right. In the medical field, we need our coffee to taste like mud. So I just got off work right now where we had some patients come in. The department is working on getting us those little eye shield things. It's needed. The first patient that we had come in, I went up to the front to see if the patient had checked in yet. And I saw this patient that was just coughing up everything that he had in himself. I looked at the person's screen that was checking him in, and yep, it was mine. It was my patient. So I went to go get, I already had my other mask that you guys saw. I went to go put that mask on. And then I put on one of those isolation gowns just because, I don't want to get whatever he's coughing up on my clothes. No, it's just that I wish we had all the protective equipment that we need, when we're working. I feel like everybody at work is coughing a lot. One had a fever for a few days a few weeks ago. I just wish we had the proper equipment to, just protect ourselves. But the best thing right now is to just boost your immune system. Boost your immune system, boost your immune system. Boost your immune system.